Good morning. Thank you so much for joining us today. My name is Molly Koenig. I am the chair of the Live Better Wellness Committee through the St. Tammany Chamber of Commerce. And our goal is to create and maintain a culture of health throughout the business community and residents of St. Tammany Parish. We are thrilled to have Dr. Hill and Dr. Peterson with us today to discuss the importance and give us the details of antibody testing and donating plasma, as well as the importance of donating blood right now. Before we introduce the two doctors, I'd like to thank Rhonda Bagby for joining us today with Humana. Humana is our sponsor. So I'd like to turn it over to Rhonda to say a few words.
Okay, hey, good morning, everyone. Thank you for joining the webinar this morning. This topic is very timely. We are continuing to hear a lot of interest about antibodies and the testing available from employers throughout the community. I have actually been involved with the St. Tammany Chamber for almost 15 years and really have seen the Chamber grow a lot. For many of us, we know that the Chamber is typically the most recognized and credible form of business network within our communities, and there are a lot of benefits that organizations, particularly small groups, can derive from being members of the Chamber. The most common benefits that people cite from their Chamber membership relate to networking, resources, access to email lists, mailing lists, credibility, those types of things. So we thank all of you for joining this morning, and if you are currently a member of the St. Tammany Chamber, we thank you for your membership. If you are not a member, we encourage you to get involved with the Chamber, and Jessica can hook you up with all of that. I was actually the chair in 2018, and we started the Live Better Committee as a way to create health and wellness resources for employers. Our work in economic development had told us that that people want to live, work, and play in healthy communities. So we wanted to put St. Tammany out there as a community that was very interested in health and wellness and make it easy for people to access those resources. So thank you for joining, and Jessica, I'll turn it back to you.
Thank you so much, Rhonda. Hi, everyone. I am Jessica Hester with the St. Tammany Chamber. We are glad that y'all joined us today for this, and we appreciate everyone who signed in. I've talked to these speakers, and we have some really great stuff going to talk about today. Just a couple of housekeeping things. Everyone who's participating, at the bottom of your screen, there is a question and answer. So if you have any questions during the presentation, go ahead and enter it in there. They do have a time at the end of theirs that they will be answering questions throughout the program. And after this, we are recording this webinar, and afterwards it will be sent out to you with any PowerPoints, and some additional handouts will be available for you. So now I'm going to go ahead and give it back to Molly so she can introduce our first speaker, Dr. Hill.
I guess you can hear me now. Thank you so much. I am thrilled to have Dr. Hill join us this morning. Thank you, Dr. Hill, for your time. He is the Chief Quality Officer at St. Tammany Health System, and he is going to explain to us antibody testing, what it means, what it entails, possible plasma donation, and I'm very excited to hear what he has to say, because I know this is a hot topic that everybody is very curious about. So thank you again, Dr. Hill, and we will turn it over to you.
So, you know, we've been through the COVID crisis over the last 2.5 months here at St. Tammany Health System, and I want to talk about today something new and exciting that we now have available at St. Tammany Health System, and that is a COVID-19 antibody test. But before we get into the antibody test itself, I want to give a little bit of background about where we are, what COVID is, so that you understand better what the antibody testing is. I'm going to talk about our experience very briefly at St. Tammany Hospital and where we are today and where we think we are in the community. We're going to go through the types of testing that we've been doing and some new testing that is going to be coming out. And then we'll talk about plasma treatment that we're doing here at St. Tammany Health System. Please, at the end of the presentation, if anything is not clear, don't hesitate to ask me to clarify. You know, one thing that the doctors do a lot is get into jargon, and I don't want to do that. I want to make this very understandable, and please feel free again to ask any questions either during this presentation or later on. I'll be happy to you know, correspond with you after this presentation is completed. So a couple of facts about coronaviruses. Coronaviruses have been around for a long time. There's a very good chance that most of us, if not all of us, have had one or more coronavirus infections in our lifetime. Now, most of us has not had COVID-19, that is the novel coronavirus, but these coronaviruses for the most are very mild. They'll cause upper respiratory tract infections, sinus congestion, sore throat, perhaps a cough, perhaps bronchitis. And at least 4 coronaviruses have been identified that really cause very mild disease. These do derive from animals, so they're considered, those are the viruses we call zoonotic viruses. You see the word zoo in there, that means they come from animals. There are many viruses that are in the animal population that cross over into the human population. One of those is HIV. We also know that influenza occurs in pigs and ducks and then crosses over into humans. And so the coronaviruses, just like these other viruses, do the same thing. And we know that there were previously 2 deadly, well-known coronaviruses that were identified earlier in 2000 to 2004. And one of these was the SARS virus, which basically has not been around since 2004, and a MERS virus, which is still around and occasionally crops up in the Middle East. So these 2 coronaviruses were very deadly. They had a very high mortality rate, and luckily they were contained and are no longer an issue at this time, and did not cause a pandemic. All of the coronaviruses are spread by respiratory secretions, and again, 80% of patients that do develop COVID have mild to moderate disease. And what I don't mean to really downplay the symptoms, because still people can get very sick, but they don't necessarily, most of these people do not require hospitalization. And the transmission of coronavirus is really interesting. A lot of people want to know, why are we concerned about the transmission and the spread of coronavirus? It is more infectious than the seasonal influenza virus. We have something called the RO, or the R0 factor. And basically, the R0 of 1 means for every 1 person infected, one other person will be infected. So the higher the R0 or the RO, the more infectious a virus is. And we now know that the COVID-19 virus has an R0 of between 2 and 3. And that's important because it's the basic reproduction number. If we did not have the social distancing, wearing a mask, washing hands, and doing some of the other things that we're going to continue to do as we open the economy, this could ramp back up and spread again. So that's important to know, that just because the numbers are down right now, if coronavirus is still in the community, it could spread again without mitigating some of the factors that spread it, like reducing respiratory secretions. SARS that I talked about was more infectious, and measles is one of the highest infectious viruses around, with an R0 of 12 to 18. So that means for every 1 person infected, if you were in a group, close-knit group indoors, 12 to 18 people would be infected after a 15 to 20-minute exposure. This is the St. Tammany Parish update, and you can see that the total positive cases that are cumulative on the red bar really have leveled out, which is a good thing. You can see that the total deaths have also leveled out. We used to have something called PUIs, or patients under investigation, before we had adequate testing. We don't have those anymore, so we don't have any of that color bar anymore. But I think this is an encouraging graph. What it means that all of the things that were done for the last 2.5 months really did work with social distancing and reduction in exposure to the virus. So what I'm going to talk about now is a type of test, and so that you understand where the antibody test comes in. We're going to talk about PCR testing. That's the nasal swab testing that everybody is familiar with, that actually tests for the virus. Then we're going to talk about the antibody test to the virus, which is a blood test we now have available to check for IgG level for previous exposure. And then we have a test for viral antigen, which is a new test that is coming out, is going to be very widely available, and we'll talk about the pluses and minuses of that test. So the PCR test that you may hear about is testing actually for viral component, for viral RNA. It's also called a molecular test. It's a real-time test. It tests to see if you have the virus at that particular moment that you're swabbed. It also will pick up viral shedding. We use this to make sure that people have clearance of the virus before they go back to an assisted living or nursing home. We also use it before they come into the hospital here at St. Tammany Health System and before they go for surgical procedure. It also can use to detect the virus in asymptomatic patients. And the highest group of asymptomatic patients that we've seen at St. Tammany Health System have been in the pediatric population. So what are the pluses and minuses of PCR testing at St. Tammany Health System? We still have limited supplies. We are getting supplies in, but we don't have, frankly, enough supplies that we can do on-site testing, quick testing. Much of our testing is still outpatient testing that takes anywhere from 24 to 72-hour turnaround. The PCR testing is useful for mitigation and containment for the virus and for contact tracing, and that's what the state is going to be using. And again, we do use it for pre-procedure and for admissions into our facility. Also, we do swab symptomatic patients in the emergency room, but because of limiting testing, we're now we're sending those to a reference lab, and those do take a couple of days to turn around. So patients who are highly suspicious of having COVID, we're asking to self-isolate until that test is available. So now we're going to move into antibody testing, which is a little bit different than what I just talked about. This is not testing for the actual virus, but testing for the antibodies that your body creates after you've been infected with the COVID virus. So it tests for prior infection. It will pick up asymptomatic cases, but we also think that many asymptomatic cases may not have as a robust antibody production as people who have symptoms. It is used for population health to develop a prevalence of disease in the population. And I'll just give you some very early numbers. In Orleans Parish, it looks like the prevalence rate on antibody testing is about 8%. At St. Tammany, in our initial testing here at St. Tammany Health System, it looks like it's around 2.8 to 3.5%. So a much lower level of infection in St. Tammany Parish. Some of the tests that have been out there because of the rapidity of approval by the government were not very good tests. So you've got to make sure if you're going to get an antibody test, it's a validated test, one that's done by a reputable company. At St. Tammany Health Systems, we use Ortho. I know that Ochsner uses Abbott, and there's a Roche test that is available as well. All of these are validated, very good tests. Some of the other tests coming from China are not always validated, so it's important if you get an antibody test, you do it with a reputable lab. I know that LabCorp and Quest also do validated testing. And it tests for the presence of the antibody. We do not do a qualitative test, so we can't tell you the amount of antibody that you're producing. It's a one-day turnaround here. And again, the lack of antibodies doesn't necessarily preclude a prior infection. we're finding, particularly in the pediatric population who have a very mild infection, that they may not produce a lot of antibodies. The other thing, controversial thing, is that a reactive test may not necessarily infer immunity. So I would not recommend that just because you have the IgG antibodies, you go without a mask. We do know now, we think that there is an immune window of maybe 6 months to 12 months, and then waning immunity after that, much like with other coronaviruses and with influenza. So we have heard stories of people getting reinfected. Most of that is the viral shedding goes off and on, and if you test enough, you're going to find some people that will shed the viruses for weeks after they've been infected. Most of those people are not infectious, however. The viral shedding is very low. And this is just a primer. You don't have to, this is not very complex. I'm just going to break this down and I'll show you what happens when you get infected. So starting way over in the left corner would be the initiation of infection. And then you can see the viral RNA, that's the genetic material in the virus, goes way up. And that's usually anywhere from 2 to 10 days after you get exposed to the virus. And then you see viral antigen, and that's parts of the virus that are released that are that you can pick up and test for. And that goes up at the same time as the genetic test. Then as you start to get better, you produce a rapid antibody called IgM, but it's a transient antibody. It only lasts for a few weeks to maybe a month or two after you have the virus, then it goes away. But that's the immune system quick response to get out there. Then IgG is produced within 2 to 3 weeks after the infection and gradually increases and then levels off and then slowly over 12 to 18 months goes down. So you can find this antibody, and that's why we're testing now for IgG, because it's an antibody that sticks around for a long time. So again, exposure triggers IgM antibodies first, and then IgG comes second and persists, and that's what we're testing for at St. Tammany Health System using the Ortho platform. The presence of these antibodies, and it will say either non-reactive, which means you don't have the IgG antibody, or reactive, which means you have it. If it says reactive, it suggests that you have previous infection. And again, I've already addressed the question of whether the immunity question. It looks like these antibodies are very specific for the novel coronaviruses, and there is no crossover for the other coronaviruses that I talked about earlier. So antibody testing is available now at St. Tammany Health System to the employees, the patients. We're offering to the employers in our community, and we'll offer to the public as well. The other test that you're going to hear about, and I just wanted to briefly mention, is a viral antigen test, because this is going to become very widely available, and it may even become a home test at some point. It tests for viral protein. The test is about 80% accurate. If it's positive, it's positive. If it's negative, it doesn't necessarily mean you don't have the virus. There's about a 10 to 20% false negative rate. So that patients who look clinically like they have it and they're negative will have to be retested with another type of test. So treatment options at St. Tammany, we do a lot of things with the patients, with the critical patients. We've learned to keep patients off of ventilators and to use something called BiPAP, or positive pressure, to support patients who have severe pneumonia. We know that patients tend to form clots, so we tend to make sure that we're monitoring that very closely, and we anticoagulate patients. Our critical care team and nurses have done a phenomenal job here, and our respiratory therapist at St. Tammany Hospital. But we have some other treatments that are now available. The first one is remdesivir. You may have heard about this. This is a Gilead product that did show in a large study that to reduce the in-hospital patient days for about 4 days, there was not a decrease in mortality, but anecdotally, some of the areas such as Seattle did see some improvement in patients who were using remdesivir. We do have this at St. Tammany Health Systems for our sicker patients. The other treatment option is plasma donation. And this is something that we've started working with the blood bank on, and this is plasma donated by patients who have been previously infected by COVID-19. They produce antibodies, they donate their blood, the plasma is taken and given to the sick patients in the ICU. So we do have plasma donor eligibility rules. You have to have evidence of a COVID-19 infection. You have to have resolution of symptoms. You can't be pregnant. And if we can measure neutralizing antibodies or quantitate the antibodies, we like to make sure that we have a good quantity of IgG antibody. In those patients,
Hold on.
Well, why don't we do that? While Erin tries to figure that out, we can go ahead and go through a couple of the questions then.
Okay.
Let's see what we have. So one of the questions is, since we don't have a cure for the other coronaviruses and they have kind of gone away, is it that possible for COVID-19? I've heard that many of the antibody tests are not reliable. What is the rating of the antibody test you are using?
So our rating of our antibody test, that's a very good question. Our rating sensitivity, so means if you have it, it's going to pick it up is 97%, and specificity which means lack of false negatives, we're at 94%, which is very good. So that the question is correct. There are some very poor antibody tests out there that are not well validated, but the antibody tests that I mentioned, Ortho, Roche, the Abbott antibody test, the test done by Quest and LabCorp are all validated tests and are safe. Some of the testing that was sent over from China and from other areas where you did a finger prick and you looked for a band to come up, those tests were not always very accurate. Some of them were, some of them weren't, but they weren't validated tests.
Okay. And another question we have is, I noticed your antibody test does not test for the IgM antibody. My company has been providing antibody tests in the area for over a month. We have seen significant number of positives for IgM only. Why is STPH not testing for IgM?
So we were testing for IgM and IgG both. And we moved just to IgG because we felt that that test was more practical for most people. Remember, IgM goes away within a few weeks. It's variable for each patient, but we felt like the IgM was not there all the time. The IgM IgG combined test is still available. I believe, I'll have to check to be sure, but we basically have both tests. But the test we feel that is more practical for patients who are have been infected and are a few weeks out is the IgG test. Obviously, if you do the IgG right after you finish with symptoms, it may not show up. So the point's well taken. If you want an antibody test at that point, you may have to do an IgM IgG test, but we're recommending wait a few weeks after the symptoms have subsided to do the antibody test.
Okay, well, let's go ahead and go back to the PowerPoint and then we'll do some more questions in a
Okay.
little bit.
So I just wanted to say that we are using plasma donations, and these are patients who have been previously infected by COVID. We can't use non-pregnant, we have to use non-pregnant women or male donors. We want to make sure that neutralizing antibody is available. And then the patients who are eligible for plasma treatment are those that are confirmed with COVID-19, those that have severe or immediate life-threatening COVID-19. These would be the patients who are in our ICU. And then we need an informed consent provided by the patient or their proxy to get the plasma. We've done about 5 plasma infusions, and I just tell you anecdotally, 3 people got better, 2 people died, but these were very sick patients, and those are the patients that we're using this on. Obviously, we're going to need a large-scale study to look at the usefulness of this, but this is something that was used in the pre-antibiotic era, and it does make sense that if you give neutralizing antibodies to somebody who's sick, it can reduce the viral load inside of a patient and hopefully reduce the inflammatory response. So I just wanted to finish up the summary slide. Again, PCR testing that you hear about or viral testing can be used to determine if you have the virus and what the incidence of viral infections are in the region. We know that we need a certain number of tests, so we want to increase this type of testing within our parish. We're continuing to do this testing at St. Tammany Health System, and it's available at our outpatient pavilion and at the Mandeville Diagnostic Center with a physician's order. We do have antibody testing now. That is a blood test. That is a meaning puncture. It's not a finger stick. It's a one-day turnaround. The presence of IgG antibodies suggests previous COVID infection and possible immunity. Antigen testing, you're going to hear a lot about. It is coming and it's going to be widely available. But again, there is a higher false negative rate with those tests. And then the use of plasma with neutralizing antibodies to COVID is being used really throughout the country. And we've worked with the blood bank, obviously, to obtain this plasma. And we've been very fortunate to give it. We also have remdesivir. And the final thing, I know the phone cut out, is that our number of COVID cases are really way down at St. Tammany. We have about 5 or 6 positive patients in-house. We're seeing some still in the community, but the numbers are way down, as I showed you in the beginning slide. And one thing I'd like to just promote is we really want people who have chronic health conditions to start coming back to the physician and to the hospital, because we're seeing some very sick people. We've had a couple of people who have had heart attacks that are days old that are not doing as well because they didn't come to the hospital with the onset of chest pain because they were worried about the emergency room. We take very strict precautions. We have very high sanitary levels in the hospital. Our environmental services group does a great job. We haven't had any new employees test positive for COVID for over a week now. And overall, we had 34 total healthcare workers that tested positive in our hospital. That doesn't mean they got it from the hospital. That means they got sick and they got tested. None of them got severely ill, thank goodness. A couple of them were hospitalized and went home. My point being is that as we transition in our community to opening up, I hope that our community also feels comfortable with going to doctor's offices, to getting their healthcare screens, and to come back into the hospital for emergency situations. So I'll stop there and answer any other questions. I know time is getting away a little bit.
Okay, thank you, Dr. Hill. Let's see, I'm going to go ahead. The government initially said all testing was free of charge. Why the $50 employees or insurance use costs? Are insurance companies to pay for the treatment if required? Gills Bar is, go ahead.
Okay, so the free testing that we've heard about from the government is for the viral testing I talked about, the PCR testing. So that is what everybody talks about if you need to be tested or swabbed, nasal swab for the presence of the virus. As far as the blood test goes, there is a cost. It's not free to St. Tammany. The cost for St. Tammany to run it and to run the test is $50. So we're not making money on the test. We're just paying for the cost of doing the test. What we do for insurance is we will process insurance, and most insurances will fully pay for the antibody test, but there may be some I can't speak for all insurances, but we've had no problem with having insurance pay for the antibody test. So the blood test and the antibody test is not the free test. The free test is the nasal swab tests that are being done all over Louisiana, and we're doing them as well.
Okay. The next question, what new information is available about the 14 mutations of COVID-19 that I have read about with regard to any immunization being developed?
It's a very good question. So far, what I've read is the mutations that have occurred are minor mutations. These are not major mutations of surface proteins that might make a vaccine not useful. However, certainly that is something we always worry about. And if you look back on influenza, sometimes we have a decent influenza vaccine, sometimes we don't. Coronaviruses do not appear to have major mutations on surface proteins like influenza does. So we think that the vaccine will be a stable vaccine. Some of the vaccines are immunizing against different parts of the viral proteins. And so, again, we're looking for the stable proteins that don't mutate so that the vaccines will have both be useful and have staying power.
Okay, we have a few more questions, but I need to switch over to Dr. Peterson because he does have a class that he has to teach shortly. So if you can stick around, we can go ahead and answer those few more afterwards.
Sure, thank you.
Okay, thank you, Dr. Hill. All right, and then let me unmute Dr. Peterson.
I think I'm unmuted.
Yep, you're unmuted. Thank you, Dr. Peterson, for joining us today.
Good morning, everyone. Can y'all hear?
We're all muted, but good morning to you.
Oh, all right, good morning. Well, thank you for having us. We wanted to give you a little idea of what we're doing at the Blood Center. First, let me at least introduce myself, let you know where I am. Tim Peterson, I'm the medical director at the Blood Center based out of here in New Orleans. I'm also medical director for LifeShare Blood Center in Shreveport and medical director at Tulane Medical Center, Blood Bank, and East Jefferson Medical Center, Blood Bank and Blood Center. So I cover about 80% of the state when it comes to blood donations and transfusion therapy. What we're asking your help with now is we are experiencing a severe shortage, not just us, but also all blood centers across the country. As the easing of restrictions, especially when it comes to elective surgeries and procedures are coming out, blood usage has ramped up immensely within a week or two. And it's not just surgical procedures. I know here at Tulane, I've collected 3 bone marrow transplant patients yesterday. So they'll be getting their transplants within the next week. Chemotherapies have resumed, organ transplantations have resumed, and of course, a lot of elective orthopedic surgeries have resumed, and those have a tendency to use a fair amount of blood components. So as of this morning, I have an extreme shortage of type O blood. We've had to do some shifting around the region to provide what needed to be done. We expect to get things ramped up, but unfortunately, we're not quite allowed to start doing many mobile drives, and with many businesses not being able to open yet, we really can't go to their sites to collect. Additionally, about 20 to 25% of our donations come from high school and college collections and mobile drives. Of course, that's been out since March. So it's been quite challenging trying to supply 35 to 50 hospitals in South Louisiana and Mississippi with 6 donor centers going almost exclusively on appointment collections. So as we start to get rolling again, we're really going to need the help of our community business leaders to get the word out and either send donors to our center. Our centers are available online at thebloodcenter.org. donors can even schedule appointments, and they can even complete the donor questionnaire to allow them to go through quicker and have less time at the center and less interaction with other donors. Of course, we're taking all of the physical distancing precautions that are recommended by the FDA and the CDC. So that's kind of where we are when it comes to blood donations. I think as we go to phase 2 and phase 3 loosening, of course, we'll get back to then. Unfortunately, that comes at a very difficult time to collect probably, and that's the summertime because schools are out. So it's going to be a challenging summer, but you know, that's my job. My job is to get blood for the patients in our community, and that's what we'll do. So we'll be here for the patients who need it. Elizabeth, is there anything you want to bring up or?
Well, one thing is I don't know if you're aware of this, there was an accident this morning involving state troopers and police officers. So we're actually having a blood drive right now at North Oaks Hospital. And every time a news alert goes off, my first thought is, I hope we have enough blood to whatever is happening. So right now, we're really looking for businesses that have inside locations where we can set up our blood drives. And also, you know, if you have a small business, or even if all your employees are working from home, you can encourage them to go to the donor centers. And we have your group numbers. So once you donate, just tell them what business or church or community organization you're with, and your business will still receive credit for it. But also, if you want to talk about the plasma donation process and some of the, you know, we've had some celebrity donors. So if you want to talk about that.
Sure. Dr. Hill was talking about convalescent plasma and testing, and we can certainly cover that. Again, I'm on both sides of the spectrum, both collecting and providing most of the plasma to the state for treatment of COVID-19 patients. Personal experience here at Tulane University, we've had 7 patients who have received it. As Dr. Hill stated, a few of the patients at St. Tammany didn't respond very well. That's because the investigational new drug license that most hospitals have signed up for, they accepted a Mayo Clinic investigation, and they laid out some very specific guidelines as to who can receive this convalescent plasma. And essentially, these were the most severe patients. Tulane decided not to go that direction, and they actually wrote 2 different investigational new programs, one for severe, but one for moderate. They wanted to have the option to treat patients a little earlier, and that's shown here to be rather beneficial. We've had 7 patients that have received the plasma. 3 received it and have been discharged within a week. 3 received it and required no more ventilation. All patients, 6 of the 7 were on ventilators. 3 are off and have since gone. We have 1 patient left in-house who received 2 doses of convalescent plasma, and he went from potential ventilator to just nasal prong oxygen. He is expected to be released this week. So they've had a wide spread of either very severe down to moderate patients. And I think other hospitals that are doing this around the country, that will provide important data to the FDA. As Doc said, when it comes to testing, and I saw an earlier question, someone asked about what type of testing is done by the blood centers. All of this treatment with convalescent plasma is being done under an investigation by the FDA. There are very strict guidelines for the patients to get this. Blood centers are not part of this investigation because this is not a virus that is spread by blood or blood components. In SARS in 2002 and then Middle Eastern syndrome or MERS in 2009 and 10, there was not a single documented transmission of either virus by blood or blood components. This is an inhalation virus problem. Some data has just come out from the CDC and the FDA talking about the spread by touching things, that the data shows that this isn't as significant as we initially thought. As we get more data on this, we're finding this out. But as far as testing goes, there are no tests required or mandated by the FDA when it comes to COVID-19 and blood donation. The guidelines are, if you are considered to be a blood donor and you'd like to volunteer as a blood donor, and you've had a history of COVID, you would have to be symptom-free for a minimum of 28 days to be a whole blood or a plasma donor. They did relax the rules on that for, whole blood or platelet donors. They did relax the rules for plasma, as you heard from Dr. Hill. Now a person has to have a documented positive PCR test for COVID-19 and have 14 days of being healthy. Not 14 days from the initiation of the test, but 14 days of feeling well. That, for a while, they were requiring people between 14 and 28 days of feeling well to get a repeat test. But what they found, and I saw a question asked about people who have come back and repeat reactive on their PCR nasal swab 14 plus days after they've been feeling well. What the FDA has done is drop that requirement after 14 days of feeling well to get retested, because what they were picking up were viral fragments. The body had attacked the virus, had inactivated it, essentially chopped it up into pieces, and yet the PCR tests are so sensitive when they detect it that they were detecting fragments of an inactive virus, a virus that was not infective. So when that requirement of getting tested a second time before donating plasma, that really allowed us to ramp up collection. It's been wonderful, the donors who have come out. You've heard, we've had Coach Payton was one of our first donors who came out, and he is actually scheduled to come in again. We've had a lot of healthcare workers and physicians who have recovered and are doing fine, and they're coming to donate. So as we build up this inventory of plasma, when it's frozen, fresh frozen plasma is good for up to a year. So we want to have a good inventory so that as patients come, and they will continue to come, just as every other viral infection we have, if they reach the point that they might benefit from this type of therapy, we'll have it available. See if there's any questions. So again, I'm sorry to answer your question. No, we're not doing any testing of the blood products for COVID, because to have antibodies, it doesn't affect anything. It means somebody had it and they're not infective. And the virus isn't spread by blood components. So FDA is not requiring it.
Does anybody else have any questions for Dr. Peterson? I do have a couple more for Dr. Hill, if you're ready, Dr. Hill. Let's see. Oh, here we go. Here's one. If you have the antibodies, will you be able to donate plasma to a specific person? Dr. Peterson.
Oh, okay.
I'm sorry.
First off, the plasma has to be compatible. Plasma is like the opposite of red cells and who can get what. So if one plasma would have to be compatible. Two, that would be a directed donation. As far as the FDA is concerned, this is a regular plasma product. Just because it's labeled to have these antibodies doesn't mean it can't be given to almost anyone, and it can be. It's plasma that can be used, and the donor has to meet all regular donation criteria. So I assume that if somebody had recovered and were compatible and wanted to donate directed donation of any type has to be ordered by the treating physician, and then the product would be collected and sent specifically for that patient at the particular hospital. So sure, could be done.
Okay.
Takes a little work.
All right, here's a question. I believe this one's for Dr. Hill. As an employer in St. Tammany Parish, how do we go about having our employees tested for the antibody testing?
We're actually setting up a process where we're going to be able to reach out to you. So if you call us, and Erin Strain is our business development person and a contact here at St. Tammany Health Systems, she will be able to set up the testing for you. We actually have a program where we actually can go out to businesses and draw and do blood draws at the businesses instead of having the employees come into a testing center. So we can get that if that person would send you their contact information, we certainly can get back to them and give them that information.
And after this, I will be sending everyone Erin and Liz's contact information so they can help you get in touch with Dr. Peterson and Dr. Hill or anything else that you need help with from the Blood Center or St. Tammany Parish Hospital.
By the way, St. Tammany Health System is going to have a blood drive here on June the 2nd from 8 a.m. to 4 p.m., just FYI.
Wonderful.
All right, here's another question. Does antigen testing detect current or prior infection?
Antigen testing is for current infection. Go back to kind of remember in your mind that little graph I showed you, the antigen and the viral excretion occur at the same time. So it's during an active infection.
Okay, and that's the last question I have that's been entered so far. Does anybody else have any other questions? Well, I do want to say thank you all for participating today. It was very, very informative. I know I learned a lot. I was really excited about this yesterday after I talked to Dr. Hill and Dr. Peterson. We did a quick run through. After this, you will be directed to take a quiz, not quiz, I'm sorry, a brief survey. It'll help us get your feedback on this. It is anonymous, so you don't have to worry about that. And it'll help us give us some ideas for things in the future that you may want to share. Now I'm going to turn it back over to Molly so she can go ahead and say our closing remarks.
Let's see, can you hear me?
We can hear you, Molly.
Okay,
Yes.
great. Thank you so much for joining us today. Thank you, Dr. Peterson and Dr. Hill. We truly appreciate your time. It was extremely informative. I know that we've had at least 44 people join us this morning, so we're excited to get the word out. And I know that it's many small business owners and residents throughout St. Tammany Parish, so this was extremely informative and helpful. Want to remind everybody to go to the blood center and donate if possible. Let's help out as much as we can as residents of St. Tammany. And thank you to everyone who joined us. We will be, like Jessica said, getting these slides and recordings to you, as well as the contact information if you have any further questions.
All right, thank you again, everybody. Everyone have a great day. Stay safe. Thank y'all for joining us at the St. Tammany Chambers Live Better Committee. And again, Dr. Hill and Dr. Peterson, thank you so much for your time, and thank you for all that you're doing in the community.
Thank you very much.
Thank you.
Thank y'all.